There haven't been any really good descriptive studies of just how many people with developmental disabilities also have a psychiatric illness or an addictions problem. So one of the first things we looked at is just to say how many people do we think have this combination. The second question then is, are these individuals getting the kind of health care that they need? Are they better off than other people? Are they worse off than other people? And then finally, the third thing we're looking at is, if we do find differences, what are some of the things that seem to be related to those differences?
My brother has Down syndrome. Growing up with him, we were always exposed to issues of health with him, and also issues of how we interact with the healthcare system. So that's why I became interested in research in that area. There are millions and millions of records of people from the general population, but also people with developmental disabilities. And we were able to develop a way to identify people with developmental disabilities within these large databases.
We got over 66,000 adults between the ages of 18 and 64. Many of these individuals also have medical problems as well as psychiatric problems. And so the evidence suggests that they have very complicated and possibly quite severe needs, which means that they need more complex services than people that just have only one problem.
With respect to health service use, we looked at how frequently people were hospitalized and how frequently they went to see a family physician.
90% of them have seen a family physician, so it's not that they're not contacting the family physician, and yet they're still being hospitalized and going to the emergency room, and not only that, but they're coming back to the hospital, to the emergency room within a month after they left. We're speculating that there are at least two different groups of people. One is the group of people that are getting poor continuity of care. In other words, they're getting fragmented primary care, and then they're going to the hospital and the emergency room. But there may be another group of people who are getting good continuity of care, but their needs are so complicated and so severe that they're sort of overwhelming the system. One of the populations that we're looking at with particular interest are people who have developmental disabilities plus a psychiatric illness plus an addictions problem. And they're a small group of people, but their level of other physical illnesses and the amount of health care and the number of times they return to health care was, compared to the other groups, it was sky high. They're a small group of people, but they are impacting the system way beyond their numbers. We need to take a much closer look at how can we get the system smoother for these individuals? How can we get the care coordinated at the clinician level and even maybe at the policy level?
They can use this data to figure out whether the health outcomes are improving over time. You can actually see if an intervention that you're thinking about of creating, or a model of healthcare for people with developmental disabilities, is it improving their lives using the administrative data and the work that we're doing.
Be aware of these individuals. Be aware that many of them will have complicated needs that are going to be beyond your single ability to help them, and so therefore really work hard to collaborate with other people that can work together with you to meet all of their needs and the complexities of what they're facing.